Hello and welcome to sqadia.com. My name is Dr. Heather Ali. With sqadia.com, you can enjoy lectures anywhere and anytime. Today is part 2 of management of chest pain in emergency department. In the previous part, we looked upon how to approach a patient with chest pain. What are the important things that you need to look for first and foremost, and how to manage life-threatening and limb-threatening problems. In this, we will go through a detailed examination, findings of examination, sub-investigations, and treatment options that we have. Let's go through the timeline. History. In history, I will explain how you should have a targeted question if you have a probable diagnosis inside your mind. For example, with the chest pain, what type of chest pain? What's the quality of chest pain? For how long this chest pain is going on? And is there any family history? Is there any history of ischemic heart disease before? And for how long this chest pain is going on? Is it localized? Is it radiating? There are multiple things you can ask in a history and can lead you to a probable or a possible diagnosis. Next would be examination. In cardiac pulmonary examination, you can find ample amount of information to reach to a diagnosis. For example, murmurs, abnormal heart sounds, right? Decreased pulse pressure, pulses deficit, difference in blood pressure, right? Pulmonary examination, rales, wheeze. You can have rhonchi, multiple findings in chest auscultations. What is the significance of this? Will be taught in detail in the section of examination. Abdominal examination for different other diseases that can present to you with chest pain. So these are important examination points that I will explain under the section of examination. Diagnosis. What is the possible diagnosis? What lab investigations, blood tests, or radiographic studies are required for making a diagnosis? What time should be the lab investigation should be done, especially for the cardiac markers? And what radiological studies, for example, echocardiography, can provide you with enough information. CT angiography can provide you with enough information. Coronary angiography can provide you with enough information. So what radiological findings or studies you need to order to get to a diagnosis? Differential diagnosis. What other diseases can present with chest pain? For example, aortic dissection can present with chest pain. Acute coronary syndrome can present with chest pain. Pulmonary embolism can present with chest pain. So there are multiple other diseases who can present with similar chest pains or symptoms similar to chest pains. Treatment options. What drug decreases morbidity and mortality? What should be done if a patient comes to you in ER? Either thrombolysis, angioplasty, or bypass surgery. What are the top treatment options you can offer to a patient with acute coronary syndrome or a patient coming with pulmonary embolism, either to anticoagulate, either to go for embolectomy? There are different options you can offer to a patient. So that these are to be taught on the section of general treatment. That's the end of part 2 of chest pain. You can enjoy thousands of medical lectures at sqadia.com. The good part about sqadia.com is you can enjoy lectures anywhere and anytime. Thank you for watching sqadia.com.